can be confidently sell your tickets stating that yes, this is what is going to happen with yoga. And the doctors will say, okay, if you can achieve that, do it. We are ready to accept you as a co-therapist. I am just using this example because they are the one who criticizes first. That's why. Then the second layer of pathway of intervention is neurotransmitter and brainwave. Like you feel a sense of clarity, mood elevation, all those things happens, no? That is because of the neurotransmitter changes. The research also has demonstrated this. So this is the second mechanism. I am not saying one is important, the other one is not important. They are both equally important. But the second mechanism is more of unobservable. At least you can see the stress reduction through the pulse rate, or heart rate, or breath rate, or maybe the muscle relaxation. But how will you see the effect of neurotransmitter? It is only through questioning, prashnam, moods, alertness, task orientation, relationship. All those things are an indicator of the neurotransmitters. Immune function regulation also has been discovered to be found to be influenced by yoga therapy. Immune function, so this is where the major fight came during the COVID time. You know who wanted to sell yoga during COVID? But then Swamiji, Swamira Ram. They wanted to say that yoga improves the immune system. We all know that when we do the breathing, we feel very, very good. But the scientific evidence is whether it is cytokines or immunoglobulin, C-reactive protein or some other blah blah blah, whatever immune array of immune functions are there. What is the status of that? There is no hard evidence. Poor thing, he was rejected because of that. He could have asked me, I would have said, don't even bother, you just silently teach me better. But that is how it is. The immune functions cannot be, unless you do a scientific evidence and show it. So usually when people come to you for therapy, they all feel better, they feel health condition improves, arogyam, angalagam, all those things are possible. Because there is some biochemical changes taking place, including at the cell level, immune level and also gene level. They say, it is scientifically said. This is the third mechanism which is subtler than the what we see at the body level. The last of this is many of you might have seen. Lifestyle activation is another important outcome of the mechanism of the yoga therapy. People who do yoga therapy, go through yoga therapy, they sleep better, they stop smoking, or they eat well, or they overeat. Anything can happen. And also they moderate in some of their behaviors. So you feel, okay, because of yoga this change is happening, or because this change is happening they are coming to yoga regularly. You don't know. Both can happen. So this is another line of change that you have to see. And then breathing and mantra enhance spiritual component. So when people say I become very spiritual, go into that breathing and chanting, it improves the spiritual orientation. That level of therapy requires a much higher level of therapeutic practice. Okay, for oneself, for others also. Okay, I am not talking about that right now. Now, this social engagement and inward orientation is another possible mechanism through which yoga works. Like I heard that from Saraswati yesterday. Raghu talked about Today morning, Raghu talked about the Chitta Vidya program. So there are certain types of therapeutic practices which can really turn inward, make you more function from within than without. Tools and techniques are external, bahya sadhanas. There is something which is deeper than the techniques, which are much more process oriented. So those type of therapeutic mechanisms work much differently than the previous one, stress alleviation or something. Very easy. When somebody comes to you with low back pain, you can just start at the first level. But if somebody has a very other conflicts and other thing, it is better to start somewhere in the middle or something. But there is something deeper than that. No, you have to do that. That is a different aspect of diagnosis. That time you have to use a higher level of therapeutic mechanism. That's why I told yoga therapy is process oriented. Now today yoga therapy is only at this first 3-4 levels only. First 4 levels. You would have seen yoga therapy in different places. They talk about stress management, lifestyle practices. They talk about immunity increasing or particular condition being symptom relief, etc. So the currently yoga therapy is at this level. So the future therapist or therapy should shift towards much deeper layer of intervention, which is here. So that is what I wanted to tell you. Now we will now look at as a therapist, what is it that we are seeing? Most of the people, most of the yoga therapists, I am not only talking about this group, even people elsewhere doing therapy, they are mainly looking for symptom relief. They just look for symptom relief. And to an extent, quality of life and functions, better function. Oh, he or she is able to function normally, have a better relationship, or something like that. So that is the outcome-based thing. And quality of life also is being emphasized. But beyond body and mind therapy is hardly emphasized. What is it that I am going to do beyond my body, beyond my mind, and if I can live that experience, that will be much, much therapeutic than the others, which is not there in yoga therapy anymore. I mean, till now it is not there. So that is where, I think Saraswati is able to bring it in that Chitta Vidya program. Because mind is used as an instrument to go beyond the mind. That is it. Now therapist. Now the role of therapist also has evolved over a period of time. It is no longer the same. Now most of the therapists have to have a clarity whether they are yoga sadhakas or yoga chikitsaka. First thing that I have to know. I started as a yoga sadhaka. Because when I started at 16 years old, I was not aiming for any samadhi or anything. It was just general fitness. Then, after some time, I understood the value of therapy because sir was there to guide me. I became a little bit of chikitsaka. Then what happened? I realized that I am not a very good therapist, so therefore let me do something different from that. So that is when I ended up with a lot of research work, less of therapy work. Okay, so as a therapist, you have to understand where do you stand at different points of time. Am I a yoga sadhaka or a chikitsaka or a yoga researcher or a yoga something? Because your time, energy to that extent will determine the type of work that you are going to do. So now what is happening in the general trend is every yoga sadhaka is also a therapist. And yoga therapists have to do their own personal sadhana also. They can't be without doing it. That is where this a person who prescribes the antibiotics need not take antibiotic. Like that. A person who prescribes the cognitive retraining for the care seeker in terms of self-talk or reframing the thoughts or something, some behavioral exercise for somebody to reduce their negative rumination, need not themselves do that. They won't do it. None of the psychologists do that. Whereas your yoga teacher, therapist will practice and then only teach. So I have a friend in KYM. She had some issues. I taught her a particular practice, meditative practice. I taught her just for 2 sessions. She practiced it. And she healed. Now she can do that much higher than what I expected. I myself was surprised. Oh, this works so much, is it? I'm going to ask that. Because she has mastered that process of what happens in the meditative practice, and she knows how to guide the student who are doing meditation, how to overcome certain types of traps. She is able to do that. That means she is going along with that process so that she can teach that much better than the one who conceptualized it. So my job is over, but she's doing it beautifully. That is personal practice. Then, do you have appropriate training to do therapy? Please check your own self. And then another thing is, yoga therapy till now was piecemeal. It was purely one component, one technique. Even there are some places where they will teach you only one technique, one kriya, one particular thing. So it is more of a component. And then sometimes some component, prana vidya. Only pranayama is taught, nothing else. And there is some people who teach holistic, everything is integrated. And some places there is absolutely no philosophy, purely some techniques are taught. Or some. So this makes a difference. It makes a difference in the therapeutic effectiveness. And who is the stakeholders? The public. So the public, if they feel that what you are doing is not giving me the benefit, or it is not its cost, but I have spent so much of my energy and time somewhere without gaining anything, then it is disillusionment. Okay, so that is why you as a therapist have to look at the process of your therapy in terms of it. Is it technique based? Is it piecemeal? Is it integrated? Is it something that is covers every aspect of a person's life? Holistic. Holistic within the person, outside the person too. Another thing is, you have to also remember the competence and training, affiliation and other ethical guidelines as therapist, which is now more and more important. I'll tell you one thing, you can make a small mistake with the body and practices, that also they will sue you. If you give a wrong practice and the person gets injured, you have to pay for the compensation. But psychologically, if you damage somebody's processes, that is much more dangerous. So therefore, when you do your therapy work, you need a supervisor. That's very important, because yoga therapy needs to become more and more professional, therefore competent, and also there should be some amount of hand holding, or what we call as protection also is needed. You agree with me or no? Am I scaring you people? No, please take that degree and certificate, practice everything you do, but remember what I am trying to tell you, because those are all, I don't want you to be surprised with certain things. That is why I am telling you. Okay? Shall we go to the next one, please? Yoga therapy, when it has become professional practice, it is a clinical practice. Okay, remember, when you do yoga therapy to somebody, you are doing a clinical practice. Like a medical professional has a certification and he puts a board that I am so and so MBBS and the other thing, I can see. Same way you are also doing a clinical practice. So when you do that, there are certain standards you have to follow, which you have to remember, because this is going to be the trend henceforth. That's why I am bringing that here. Okay? So one is clear understanding of the rationale of the therapy, rationale of your therapy. Okay? What I am trying to say is, let us say, I'll take simple condition. Let us say somebody comes with back pain and there is an issue of obesity, let us say. And then there is some, of course there is no structural damage. Let us say I am just black. Okay, so these are the two things. I am just taking for the sake of, and the person also feels little stressed. Some stress is there. Okay, don't ask me, whatever, some stress is there. Now this is the issue. Now, an understanding of your rationale means you would have given a course like this. Some few times, and then you may give something like this. Madam, somebody just take the course as I have done. And then you might have given something to relax the person with some arm movements and then some pranayama. Can anyone see some meaning in this posture? What is the meaning of it? All of us will find some meaning. Okay, rationale is a meaningful outcome that you expect because of certain types of movements or breathing or chanting or whatever that you do. What is it that you expect? That is called rationale. Rationale is also reasoning. One of the reasoning is, in this condition, I have found that her back pain is because of lordosis. That is, I am using this technical term because there is a lot of arch in the back, and there is weight is distributed onto the leg and the person is feeling heavy. Let us say, this is the reason. I might have got a diagnosis. Between the diagnosis and the therapy, whatever that I am not saying this course is perfect, it may be wrong also. But the rational part is, I have said I have to reduce the overstretch of the spinal column. I may use such type of language. Rationale is a reason, a logical reason for certain types of intervention. Somebody has the inability to inhale. We tell them to chant. We say, don't bother about inhale. When you lower the arms, you say, ma, you lower. Why? The rationale here is, when you say ma sound, what happens? The diaphragm goes up, so that next time the inhale will happen automatically. Inhale happens automatically. That is the rationale. So, you as a therapist should know the rationale for the therapy that you are doing. You can't just fill up your course with some 1, 2, 3, 4, 5, 6, okay, this posture, that posture, like this flower. We can't have that. Okay? First, that is what is the basis of evidence-based practice. Basis of evidence-based practice is why you are doing what you are doing. If you are doing something, why you are doing. So if somebody comes to me for the supervision, they would have given a course. I'll say, okay, tell me why you want to do that. I agree with the course. I'll give you a 10, 100 out of 100 marks. But tell me why you are doing. No, madam, if she opens up the chest, it will be good and the breathing will be good. Fine, that's good. So your rationale is to improve the breathing. Like that, you have to have a clear rationale. Mechanism involved in the process. So, okay, the moment I put this way and ask the person to stay 10 counts. I have not given breathing. 10 counts when you are in this position. Again do this and come back to this. So what I am trying to do is, I am increasing a particular mechanism in the body, that is curvature of the spine, so that stretch is there in the individual. Okay, let us say I am just trying to do that. Why not this, madam? We can do this also, it is very good. Somebody, one of your colleague may ask, yes, that also can be done, but that person when they bend, it doesn't like me, but this would be better. By bending the knee, it is better for me to rest the back than not bending the knee. Some rationale should be there. You should be able to say, this works better than this. If I can prove that, that means I am having a very clear rationale. Something like that. Then, most of the time, what is the outcome of it? So, for postures or breathing or for your lifestyle interventions that you give, what is the outcome that you are going to have? Specific outcome. 2 sessions of this, I expect this person to reduce the pain in the back. 2 sessions or 3 sessions. Like that, you should have a very clear, time-bound, specific outcome in the expected results of your intervention. That is going to be the standard of therapy henceforth, not now. Till now, people might have just played around with many of the practices. Don't do that. You have to have a standard outcome. And also the generic outcome. A person feels well, sleeps well, and the person feels very joyous, and he or she comes to class regularly. Fine. That is all generic outcome. They come to class regularly because it's such a nice atmosphere to sit and talk with everybody. Fine. That is generic outcome, not specific. Okay. This is another aspect of clinical practice. Another thing is standardized protocol application. Now, what has happened here in yoga is, we always do that. We say, especially in Krishnamacharya's tradition, individualized yoga, we do not give specific courses for specific condition. Agree? Yes. Hey, there's no loud agree. Yeah. Half of my research life I have escaped by saying this, because that way I have escaped all questions. Okay, I have survived on that. That's why I'm telling you so confidently. By saying no, we don't give specific courses for specific condition. Diabetes, no. There is one group of health professionals sitting there. They are rejecting all my paper because you are not specific with your protocol. This is going to become a big issue henceforth in yoga therapy. They want to standardize everything, standardize all the course. You can't say, I will give this, I will give this, I will give this. No. There's one research going on in Deakin University, and they have a protocol standardization for eating disorders. Now, eating disorders it's anxiety based. So, mind says, okay, you have to relax the person, another thing. I started with the protocol specification with some 70 postures. Then again it went back and forth, and then we reduced it to some 35 postures. Because everybody was telling, this posture is good, this posture is good, this breathing is good, this meditation is good. So like that it went on and went on. That researchers know, they were angry because we are not specified. If somebody had so much of time to provide, the person won't have eating disorder at all. Ultimately, ultimately they reduced it to some 20 and they are trying to work around that for individualized. They are individualizing it. But they want to know why you have to give this posture, why not that. So then they sent me 3 months back one set of paper and I said, okay, you include this, don't include this, I have to give explanation also. So my mind was thinking, okay, this works or this doesn't work. Afterwards, 3 months later, they sent me again, please redo this sentence. I had forgotten what I had done. Oh, really, really difficult. Now they have standardized the diabetes protocol in India. That is, what type of postures you have to give for diabetes. Okay, they have standardized, but they have not yet got the evidence yet. So what is the criteria for diabetes? You have to reduce the HbA1c level. In India, it is usually average is 8.5. So if you reduce it by 0.5, no, it is taken as an evidence. If your yoga therapy makes somebody to reduce their blood sugar hypoglycemic level by 5 points in 3 months, that is taken only 3 months, no? Yeah, so that means you have successful. Latha has found a nice cure for diabetes. Like that, they will say. There are so many other parameters. I am not taking those things at all. So this from 8.5 to 5 it should come. So they have identified some postures, neck loosening exercise, all those turning the neck, another thing, Shanka Prakshalana. Then there is some forward bends. Pada Hastasana, Trikonasana, and then there is some not Mahamudra, Marichasana, and like that there is some more is there. And then Shalabhasana, like that they have identified. This protocol was developed by a team of yoga experts along with Indian Medical Association people over repeated discussion, and they have identified some 14 or 15 postures